1. What is the most common risk factor for peripheral artery disease, PAD? A. Hypertension. B. Smoking. C. High HDL cholesterol. D. Low sodium intake. Answer: B. Smoking. Rationale: smoking is the most significant risk factor for PAD as it causes endothelial damage, vasoconstriction, and increased plaque buildup. Hypertension, A, contributes but is not as strongly associated. High HDL cholesterol, C, is protective against atherosclerosis. Low sodium intake, D, does not directly contribute to PAD. 2. Which symptom is most characteristic of early-stage PAD? A. Intermittent claudication. B. Rest pain. C. Gangrene. D. Edema. Answer: A. Intermittent claudication. Rationale: intermittent claudication, A, is a hallmark symptom of early PAD, characterized by muscle pain during exertion that resolves with rest. Rest pain, B, occurs in more advanced stages. Gangrene, C, is a late-stage complication. Edema, D, is more common in venous insufficiency rather than PAD. 3. A patient with suspected PAD undergoes an ankle brachial index, ABI, test. An ABI of 0.65 indicates A. Normal circulation. B. Mild PAD. C. Moderate PAD. D. Severe PAD. Answer: C. Moderate PAD. Rationale: an ABI of 0.65 suggests moderate PAD. Normal ABI is 1.0 to 1.4, A. Mild PAD, B, is 0.7 to 0.9. Severe PAD, D, is less than 0.4 and indicates critical ischemia. 4. Which diagnostic test is most commonly used first to evaluate PAD? A. Angiography. B. Doppler ultrasound. C. CT scan. D. MRI. Answer: B. Doppler ultrasound. Rationale: Doppler ultrasound, B, is a non-invasive and widely used initial test for PAD, assessing blood flow. Angiography, A, is more invasive and used for treatment planning. CT, C, and MRI, D, are less commonly used for PAD diagnosis. 5. Which lifestyle modification is most important in slowing PAD progression? A. Reducing sodium intake. B. Increasing red meat consumption. C. Smoking cessation. D. Taking daily vitamins. Answer: C. Smoking cessation. Rationale: smoking cessation, C, is the most effective way to slow PAD progression. Reducing sodium, A, helps in hypertension but is less critical for PAD. Red meat consumption, B, and daily vitamins, D, have no direct benefits for PAD management. 6. A patient with PAD reports leg pain at rest that worsens when elevating the legs. What does this indicate? A. Early PAD. B. Venous insufficiency. C. Critical limb ischemia. D. Deep vein thrombosis, DVT. Answer: C. Critical limb ischemia. Rationale: rest pain worsening with leg elevation suggests critical limb ischemia, C, a severe PAD stage. Early PAD, A, presents with claudication, not rest pain. Venous insufficiency, B, typically causes relief with leg elevation. DVT, D, presents with swelling and tenderness, not ischemic pain. 7. Which medication is commonly prescribed to reduce PAD-related cardiovascular risks? A. Warfarin. B. Atorvastatin. C. Acetaminophen. D. Furosemide. Answer: B. Atorvastatin. Rationale: atorvastatin, B, reduces atherosclerosis progression by lowering LDL cholesterol, which is crucial for PAD patients. Warfarin, A, is used for clot prevention, but is not first-line for PAD. Acetaminophen, C, does not address the underlying vascular issue. Furosemide, D, is a diuretic used for heart failure and hypertension. 8. A nurse is teaching a patient with PAD about foot care. Which statement indicates the need for further education? A. I will inspect my feet daily. B. I should avoid walking barefoot. C. I will soak my feet in warm water daily. D. I will wear properly fitting shoes. Answer. C. I will soak my feet in warm water daily. Rationale. Soaking feet, C, can increase the risk of burns and infection due to poor circulation. Daily inspection, A, avoiding barefoot walking, B, and wearing proper shoes, D, are all correct foot care practices for PAD patients. 9. A patient with PAD is prescribed cilostazol. What is the primary benefit of this medication? A. Improves walking distance. B. Lowers blood pressure. C. Prevents clot formation. D. Reduces cholesterol levels. Answer. A. Improves walking distance. Rationale. Cilostazol, A, is a phosphodiesterase inhibitor that improves claudication symptoms and increases walking distance in PAD patients. Lowers BP, B, is not its primary function. Clot prevention, C, and cholesterol reduction, D, are achieved with other medications. 10. What is the primary surgical intervention for severe PAD with critical ischemia? A. Balloon angioplasty. B. Amputation. C. Saphenous vein graft bypass. D. Endovenous laser therapy. Answer. C. Saphenous vein graft bypass. Rationale. Bypass surgery, C, is the primary intervention for severe PAD when revascularization is required. Balloon angioplasty, A, is used for moderate cases. Amputation, B, is a last resort. Endovenous laser therapy, D, is used for varicose veins, not PAD. 11. Which symptom is most indicative of advanced PAD? A. Leg pain that resolves with rest. B. Increased hair growth on legs. C. Dependent rubor. D. Warm, swollen legs. Answer. C. Dependent rubor. Rationale. Dependent rubor, C, a reddish-blue discoloration of the lower extremities when in a dependent position, indicates advanced PAD. Leg pain relieved by rest, A, suggests early-stage PAD. Increased hair growth, B, is incorrect because PAD causes hair loss. Warm, swollen legs, D, are more indicative of venous insufficiency, not PAD. 12. Which exercise recommendation is most appropriate for a patient with PAD? A. High-intensity sprinting. B. Prolonged bed rest. C. Supervised walking program. D. Weightlifting. Answer. C. Supervised walking program. Rationale. A supervised walking program, C, improves circulation and reduces claudication symptoms in PAD patients. Sprinting, A, may exacerbate symptoms. Bed rest, B, is not recommended as it increases the risk of thrombosis. Weightlifting, D, has benefits, but does not directly address intermittent claudication. 13. Which class of medication is contraindicated in patients with PAD? A. Beta blockers. B. Antiplatelets. C. ACE inhibitors. D. Statins. Answer. A. Beta blockers. Rationale. Beta blockers, A, can cause peripheral vasoconstriction, worsening PAD symptoms. Antiplatelets, B, ACE inhibitors, C, and statins, D, are beneficial in PAD management. 14. What is the primary cause of PAD? A. Deep vein thrombosis. B. Atherosclerosis. C. Vasculitis. D. Trauma. Answer. B. Atherosclerosis. Rationale. PAD is primarily caused by atherosclerosis, B, which leads to narrowed and hardened arteries. DVT, A, affects veins, not arteries. Vasculitis, C, and trauma, D, are less common causes. 15. Which food choice is best for a patient with PAD? A. Fried chicken. B. Whole grains and salmon. C. Processed meats. D. White bread and butter. Answer. B. Whole grains and salmon. Rationale. Whole grains and salmon, B, provide fiber and omega-3 fatty acids, reducing inflammation and improving circulation. Fried foods, A, processed meats, C, and refined carbohydrates, D, contribute to atherosclerosis progression. 16. Which surgical intervention involves removing a blockage from an artery in PAD? A. Thrombectomy. B. Endarterectomy. C. Coronary bypass. D. Stent placement. Answer: B. Endarterectomy. Rationale: endarterectomy, B, involves removing a plaque from an artery. Thrombectomy, A, removes a clot, not plaque. Coronary bypass, C, refers to heart arteries, not peripheral arteries. Stent placement, D, involves inserting a stent, but does not remove plaque. 17. A PAD patient reports foot pain at night, relieved by dangling the leg over the side of the bed. What does this indicate? A. Chronic venous insufficiency. B. Advanced arterial insufficiency. C. Cellulitis. D. Deep vein thrombosis. Answer: B. Advanced arterial insufficiency. Rationale: rest pain relieved by dependent positioning, B, suggests critical limb ischemia, an advanced stage of PAD. Venous insufficiency, A, typically improves with leg elevation. Cellulitis, C, and DVT, D, present with swelling and warmth, not ischemic pain. 18. What is the most serious complication of untreated PAD? A. Pulmonary embolism. B. Stroke. C. Limb amputation. D. Myocardial infarction. Answer: C. Limb amputation. Rationale: severe PAD, C, can lead to critical limb ischemia and tissue necrosis, necessitating amputation. Stroke, B, and MI, are associated with atherosclerosis, but are not the most direct PAD complication. Pulmonary embolism, A, is a venous issue, not an arterial one. 19. Which ABI value suggests severe PAD? A. 0.9. B. 0.7. C. 0.5. D. 0.3. Answer: D. 0.3. Rationale: an ABI of 0.3, D, indicates severe PAD. Mild PAD, A, is 0.7 to 0.9, moderate PAD, B, is 0.5 to 0.7, and critical limb ischemia is less than or equal to 0.4. 20. Which symptom differentiates PAD from chronic venous insufficiency? A. Swelling in the lower legs. B. Ulcers on the medial ankle. C. Pain relieved by elevation. D. Cool, pale skin. Answer: D. Cool, pale skin. Rationale: PAD causes cool, pale skin, D, due to reduced blood flow. Venous insufficiency symptoms include swelling, A, ulcers on the medial ankle, B, and pain relief with leg elevation, C. 21. Which group is at highest risk for PAD? A. A 45-year-old with high HDL cholesterol. B. A 60-year-old with a history of smoking. C. A 30-year-old who runs marathons. D. A 50-year-old with no medical history. Answer: B. A 60-year-old with a history of smoking. Rationale: smoking and age, B, are major PAD risk factors. High HDL, A, is protective. Physical activity, C, reduces risk. No medical history, D, suggests lower risk. 22. A nurse assesses a patient with PAD. Which finding requires immediate intervention? A. ABI of 0.8. B. Dependent rubor. C. Cold, cyanotic foot with absent pulses. D. Intermittent claudication. Answer: C. Cold, cyanotic foot with absent pulses. Rationale: a cold, cyanotic foot with absent pulses, C, indicates acute arterial occlusion, a medical emergency. ABI of 0.8, A, suggests mild PAD. Dependent rubor, B, and claudication, D, indicate chronic PAD, but are not emergencies. 23. Which symptom is a hallmark sign of intermittent claudication in PAD? A. Leg swelling. B. Burning pain in the feet at night. C. Muscle pain in the legs relieved by rest. D. Red, warm skin over the calf. Answer: C. Muscle pain in the legs relieved by rest. Rationale: intermittent claudication, C, is exercise-induced leg pain that resolves with rest. Leg swelling, A, and red, warm skin, D, are signs of venous disease. Burning pain at night, B, suggests neuropathy or advanced ischemia. 24. Which diagnostic test is most commonly used first for PAD assessment? A. Angiography. B. Ankle brachial index, ABI. C. Doppler ultrasound. D. Magnetic resonance angiography, MRA. Answer: B. Ankle brachial index, ABI. Rationale: ABI-B is a non-invasive and first-line test for PAD. Angiography, A, and MRA-D are invasive or advanced imaging. Doppler ultrasound, C, is used for further evaluation but is not the first test. 25. What lifestyle modification has the greatest impact on slowing PAD progression? A. Drinking red wine. B. Daily weightlifting. C. Quitting smoking. D. Eating a high-protein diet. Answer: C. Quitting smoking. Rationale: smoking cessation, C, significantly slows PAD progression. Red wine, A, and high-protein diets, D, are not primary interventions. Exercise, B, is beneficial but not as critical as quitting smoking. 26. A patient with PAD is prescribed cilostazol, Pleadol. What is the primary purpose of this medication? A. Reduce blood pressure. B. Improve walking distance. C. Prevent blood clots. D. Reduce cholesterol. Answer: B. Improve walking distance. Rationale: cilostazol, B, is a vasodilator that improves claudication symptoms. Antihypertensives, A, and statins, D, are also used in PAD but have different primary functions. Antiplatelets, C, prevent clots but do not directly improve walking ability. 27. Which statement by a patient with PAD requires further teaching? A. I should elevate my legs frequently. B. I will inspect my feet daily for wounds. C. I should wear well-fitting shoes at all times. D. I will avoid exposing my feet to extreme temperatures. Answer: A. I should elevate my legs frequently. Rationale: leg elevation, A, reduces arterial blood flow, worsening PAD symptoms. Daily foot checks, B, proper footwear, C, and avoiding temperature extremes, D, help prevent complications. 28. Which PAD patient should be referred for urgent vascular surgery? A. A patient with a non-healing ulcer. B. A patient with an ABI of 0.6. C. A patient with chronic claudication. D. A patient with acute limb ischemia. Answer: D. A patient with acute limb ischemia. Rationale: acute limb ischemia, D, is a medical emergency requiring urgent intervention. Chronic PAD, A, B, C, is serious but not immediately life-threatening. 29. What is the best non-invasive exercise therapy for PAD? A. High-intensity interval training. B. Supervised treadmill walking. C. Swimming. D. Yoga. Answer: B. Supervised treadmill walking. Rationale: supervised treadmill walking, B, is proven to improve walking tolerance in PAD. High-intensity training, A, AB too strenuous. Swimming, C, and yoga, D, are beneficial but do not directly address claudication symptoms. 30. A patient with PAD is prescribed clopidogrel, Plavix. What is the drug's mechanism of action? A. Vasodilation. B. Reducing cholesterol levels. C. Inhibiting platelet aggregation. D. Lowering blood glucose. Answer: C. Inhibiting platelet aggregation. Rationale: clopidogrel, C, is an antiplatelet medication that prevents thrombosis in narrowed arteries. It does not vasodilate, A, lower cholesterol, B, or affect blood glucose, D. 31. Which finding is most concerning in a PAD patient? A. Thickened toenails. B. Muscle atrophy in the legs. C. Ulcer with black eschar on the toes. D. Ankle brachial index of 0.8. Answer: C. Ulcer with black eschar on the toes. Rationale: Necrotic ulcers, C, suggest critical limb ischemia, a serious complication of PAD. Thickened toenails, A, and muscle atrophy, B, are chronic findings. ABI of 0.8, D, indicates mild PAD, not an emergency. 32. What should be included in foot care education for a PAD patient? A. Soak feet daily in warm water. B. Walk barefoot indoors to improve circulation. C. Trim toenails carefully and check feet daily. D. Apply lotion between the toes. Answer: C. Trim toenails carefully and check feet daily. Rationale: daily foot inspection, C, and careful nail trimming prevent wounds and infections. Soaking feet, A, may lead to skin breakdown. Walking barefoot, B, increases injury risk. Lotion, D, can cause moisture buildup and infection. 33. Which symptom suggests worsening PAD? A. Leg pain at rest. B. Decreased calf circumference. C. Warmth and redness in the legs. D. Increased hair growth on the feet. Answer: A. Leg pain at rest. Rationale: rest pain, A, indicates severe ischemia and progressive PAD. Decreased calf size, B, can occur but is not the primary indicator. Warmth/redness, C, suggests venous disease, not PAD. Hair loss, D, is more common than increased hair growth. 34. Which dietary recommendation is most appropriate for a PAD patient? A. High-fat, low-carb diet. B. High-fiber, low-cholesterol diet. C. Increased red meat and processed foods. D. No dietary modifications needed. Answer: B. High-fiber, low-cholesterol diet. Rationale: high-fiber, low-cholesterol, B, helps reduce atherosclerosis risk. High-fat diets, A, and processed foods, C, worsen cardiovascular health. Dietary modification is necessary, D, to prevent disease progression. 35. What is the primary underlying cause of PAD? A. Atherosclerosis. B. Venous insufficiency. C. Deep vein thrombosis. D. Varicose veins. Answer: A. Atherosclerosis. Rationale: atherosclerosis, A, is the leading cause of PAD, involving plaque buildup in the arteries. Venous insufficiency, B, and varicose veins, D, affect veins, not arteries. DVT, C, is a clotting disorder, not a chronic arterial disease. 36. Which symptom differentiates critical limb ischemia from intermittent claudication? A. Pain only during activity. B. Leg swelling. C. Rest pain and non-healing ulcers. D. Redness and warmth. Answer: C. Rest pain and non-healing ulcers. Rationale: critical limb ischemia, C, presents with rest pain and non-healing ulcers, indicating severe arterial obstruction. Claudication pain, A, occurs only with activity. Leg swelling, B, and warmth/redness, D, suggest venous disease. 37. What is a common physical exam finding in a patient with PAD? A. Bounding pedal pulses. B. Absent or diminished pulses. C. Bilateral ankle edema. D. Skin with erythema and warmth. Answer: B. Absent or diminished pulses. Rationale: PAD reduces blood flow, leading to diminished or absent pulses. B. Bounding pulses, A, are seen in conditions like aortic regurgitation. Edema, C, and warmth, D, suggest venous disorders. 38. Which of the following is an appropriate exercise recommendation for a PAD patient? A. Walk until pain occurs, then rest and resume. B. Avoid walking due to pain. C. Perform high-impact activities like running. D. Engage in weightlifting exercises. Answer: A. Walk until pain occurs, then rest and resume. Rationale: supervised walking therapy, A, helps build collateral circulation and reduce symptoms. Avoiding exercise, B, worsens PAD. High-impact exercise, C, may be too strenuous. Weightlifting, D, does not improve arterial circulation. 39. A nurse is teaching a PAD patient about foot care. Which statement indicates a need for further education? A. I will wear thick, warm socks to prevent cold exposure. B. I should check my feet daily for cuts or wounds. C. I should trim my toenails straight across. D. I should soak my feet daily in warm water. Answer: D. I should soak my feet daily in warm water. Rationale: soaking feet, D, can lead to skin breakdown and infection. Thick socks, A, help prevent cold-related vasoconstriction. Daily foot inspection, B, and proper nail trimming, C, prevent complications. 40. A PAD patient asks why statins are prescribed. What is the nurse's best response? A. They help relieve leg pain. B. They prevent blood clots from forming. C. They lower cholesterol and slow disease progression. D. They increase circulation by dilating blood vessels. Answer: C. They lower cholesterol and slow disease progression. Rationale: statins, C, reduce cholesterol, slowing atherosclerosis. They do not relieve leg pain, A, prevent clots, B, like anticoagulants, or directly dilate blood vessels, D, like vasodilators. 41. A patient with PAD reports leg pain when elevating the legs. What does this indicate? A. Venous insufficiency. B. Acute limb ischemia. C. Rest pain due to arterial insufficiency. D. Deep vein thrombosis. Answer: C. Rest pain due to arterial insufficiency. Rationale: PAD rest pain worsens with leg elevation, C, due to reduced arterial perfusion. Venous insufficiency, A, causes discomfort with prolonged standing, DVT, D, presents with swelling and tenderness, and acute ischemia, B, is sudden and severe. 42. Which food should a PAD patient limit to manage their condition? A. Green leafy vegetables. B. Fatty red meats. C. Whole grains. D. Fresh fruits. Answer: B. Fatty red meats. Rationale: high-fat red meats, B, contribute to atherosclerosis and PAD progression. Leafy greens, A, whole grains, C, and fruits, D, are heart-healthy choices. 43. A nurse assesses a PAD patient's feet and finds a pale, cool foot with no pulse. What is the priority action? A. Elevate the affected leg. B. Apply warm compresses. C. Notify the healthcare provider immediately. D. Encourage ambulation. Answer: C. Notify the healthcare provider immediately. Rationale: absent pulses and cool extremity, C, suggest acute limb ischemia requiring immediate intervention. Elevation, A, worsens arterial blood flow. Heat, B, can cause burns. Ambulation, D, is not appropriate in an ischemic limb. 44. A PAD patient reports cold, numb toes, and severe leg pain. What is the likely cause? A. Venous insufficiency. B. Deep vein thrombosis. C. Acute arterial occlusion. D. Cellulitis. Answer: C. Acute arterial occlusion. Rationale: acute occlusion, C, causes sudden pain, pallor, and cold extremities. Venous insufficiency, A, and DVT, B, cause swelling and warmth. Cellulitis, D, presents with redness and fever. 45. What is the most common site of PAD development in the lower extremities? A. Tibial arteries. B. Popliteal artery. C. Femoral artery. D. Dorsalis pedis artery. Answer: C. Femoral artery. Rationale: the femoral artery, C, is the most common site of atherosclerosis in PAD. The popliteal artery, B, and tibial arteries, A, may also be affected, but less frequently. The dorsalis pedis artery, D, is a distal artery, not the primary site of disease. 46. A patient with PAD is prescribed cilostazol, Pletal. What is the purpose of this medication? A. Reduce cholesterol levels. B. Increase blood flow to the legs. C. Prevent blood clots. D. Lower blood pressure. Answer: B. Increase blood flow to the legs. Rationale: cilostazol, B, is a vasodilator that improves claudication symptoms by increasing blood flow. Statins. A. Reduce cholesterol, anticoagulants. C. Prevent clots and antihypertensives. D. Lower blood pressure. 47. Which intervention is most important for a patient with PAD who smokes? A. Increase physical activity. B. Begin aspirin therapy. C. Enroll in a smoking cessation program. D. Wear compression stockings. Answer. C. Enroll in a smoking cessation program. Rationale. Smoking cessation, C, is the single most effective way to slow PAD progression. While exercise, A, and aspirin, B, help, they do not directly address the root cause. Compression stockings, D, are for venous disease, not PAD. 48. A patient with PAD reports leg pain at rest. What does this indicate? A. Mild PAD. B. Moderate PAD. C. Severe PAD with critical limb ischemia. D. Venous insufficiency. Answer. C. Severe PAD with critical limb ischemia. Rationale. Rest pain, C, signals severe arterial insufficiency and potential tissue necrosis. Mild, A, and moderate, B, PAD cause claudication, not rest pain. Venous insufficiency, D, causes leg swelling and discomfort, but not arterial pain. 49. Which test is the gold standard for diagnosing PAD? A. Duplex ultrasound. B. Ankle brachial index, ABI. C. Magnetic resonance angiography, MRA. D. Angiography. Answer. D. Angiography. Rationale. Angiography, D, is the definitive test for PAD, identifying arterial blockages. ABI, B, is a screening tool, duplex ultrasound, A, provides non-invasive imaging, and MRA, C, is used for further evaluation. 50. What is the recommended ABI range indicating moderate PAD? A. 0.9 to 1.3. B. 0.41 to 0.7. C. 0.71 to 0.89. D. Less than 0.4. Answer. B. 0.41 to 0.7. Rationale. An ABI of 0.41 to 0.7, B, indicates moderate PAD. Normal ABI, A, is 0.9 to 1.3. Mild PAD, C, is 0.71 to 0.89. Severe PAD, D, is less than 0.4, indicating critical ischemia.